In this video, we are going to introduce various foundational exercises that are incorporated within pelvic floor rehabilitation. These exercises are not only beneficial for those with pelvic floor dysfunction, but also useful for individuals with core weakness, low back pain, hip pain, and many other musculoskeletal or neurological conditions. This video is going to take you through various positions and movement patterns in coordination with breathing and muscle activation guidance. This exercise progression can be very important to ensure appropriate abdominal and pelvic floor activation, stabilization, and coordination. Ensuring that these muscles are appropriately utilized with movement can be crucial in the rehabilitation process for restoring function and strength. If your physical therapist has outlined a specific exercise video segment to view, please use the following time markers for each exercise.
This first exercise is focusing on a process called diaphragmatic breathing, the effort of using your diaphragm muscle to control a full inhale-exhale cycle. Lying on your back is generally the easiest position to focus on your diaphragmatic breath and facilitate reduced chest movement. It is important to maximize the movement of your belly and minimize the accessory movement of your chest while working on this exercise in order to improve the strength and coordination of your diaphragm and minimize use of accessory breathing muscles. Overuse of accessory breathing muscles can lead to tightness in your neck, chest, and contribute to other postural deficits. Here we begin with you lying on your back with your feet up so that the small of your back is resting on the floor. Place one hand on your abdomen and the other on your chest. As you take a deep inhale through your nose, focus on filling your belly with air while keeping your chest quiet and still. It should take 3 to 5 seconds to fill your belly. Then, on the exhale, let the air escape out your mouth as you slowly let your belly fall back down. And then as you push the remaining air out, gently draw that belly in toward your spine. Repeat this process as directed by your physical therapist. When we are working on any variety of core training, it is important to ensure appropriate coordination of the diaphragm. If you imagine a soda can as a representation of your abdomen, the diaphragm muscle is the top of the soda can. Your abdominal muscles and some spinal stabilizing muscles are the outside of the can, and your pelvic floor muscles line the bottom of the can. These muscles all must work in harmony with each other in order to ensure appropriate function. In addition to simply isolating the diaphragm with this exercise, your physical therapist may also layer in coordination of the pelvic floor muscles. This is something that will be alluded to later in this video. This exercise is a progression from the diaphragmatic breathing exercise performed when lying on your back. When you are upright, either sitting or standing, it can be more challenging to limit the use of muscles in your neck and chest to control full expansion of your lungs. So it is important to progress this exercise and work on isolation of the diaphragm in this functional position. In performing this exercise, it is the same process as when you are lying down. You begin by placing one hand on your abdomen and the other on your chest. As you take a deep inhale through your nose, focus on filling your belly with air while keeping your chest quiet and still. It should take 3 to 5 seconds to fill your belly. Then, on the exhale, let the air escape out your mouth as you slowly draw your belly in toward your spine. Repeat this process as directed by your physical therapist. If you are also coordinating your pelvic floor muscles with this exercise, think about bearing down and lengthening your pelvic floor into the TheraBall, if that's what you're seated on, as you inhale. Then, on the exhale, activate your pelvic floor and draw these muscles up and away from the TheraBall. Repeat as directed.
In this segment, we will be going through an exercise that focuses on bridging in both diaphragmatic breathing and pelvic floor activation. This exercise is more advanced, and typically individuals progress with diaphragmatic breathing in a lying down position to upright and then progressing to this position. To begin the exercise, please start on your hands and knees with your hands directly below your shoulders and your knees directly below your hips. Your spine should be straight, not arched or rounded. Make sure your shoulders are also active. They should not be caving in together. Start by focusing just on your breath, making sure you can let your belly expand towards the floor with your inhale and draw back towards your spine with the exhale. Then, as you inhale, rock your hips back into child's pose position, letting your belly push down as you move. You will then return back to the starting position in sync with an exhale, drawing your belly towards your spine. Once you are comfortable with this pattern, start to layer in focusing on your pelvic floor, bearing down and lengthening your pelvic floor as you lower into child's pose, then activating and drawing in your pelvic floor as you exhale, returning to the original position. continue this movement as directed by your physical therapist. This exercise can be helpful for preparing for functional movements such as picking up toys off the floor, making the bed, or pulling laundry out of the dryer. This final exercise is focused on coordinating your breath with functional movement. While it is not always necessary to coordinate each breath with each repetition, for those struggling with leakage, prolapse, low back pain, or pelvic pain, it can be useful to work on training and coordinating these muscles with movement. To begin the exercise, start by sitting on the edge of a chair or stable seated surface. Focus on exhaling and drawing your belly in towards your spine as you go to rise from the chair or surface. Then, on the way back down, you can inhale and let your belly expand. It may be beneficial to coordinate pelvic floor activation with this exercise as well, if directed by your PT. This would mean that you activate and draw up your pelvic floor muscles as you rise from the chair and then relax as you sit back down.
We hope you found this video helpful. Again, these exercises are more of a progression to be followed depending on your needs as outlined by your physical therapist. This video is not intended to be used as a comprehensive exercise session, as most of the time, your physical therapist will be replacing some exercises with others as you advance in your own course of care. If you have any questions about your specific exercise dosage or specific modifications, please reach out to your physical therapist. Thank you for watching.